尊敬的各位来宾，大会即将开始，请您尽快入座，并将手机及其他电子设备调至震动或静音模式。感谢您的配合。Dear guests, the conference will commence shortly. Please take your seat as soon as possible and set your mobile phone and other electronic devices to vibrate or silent mode. Thank you for your cooperation.
Ladies and gentlemen, good morning. Welcome to this session. The subject of this panel is strengthening global coordination to address global public health emergencies. It is a very important subject. I think after the COVID-19 crisis, everybody understands the importance of this subject. However, it is a very, very complex issue. My name is Dr. Klaus Schustereder. I'm from Switzerland. I'm a trained medical doctor. I see patients regularly. And I'm very happy to have six very interesting, very knowledgeable people. We have first Professor Gao, George Gao, top scientist from the Chinese Academy of Science. Dr. Gao was the former director of the Center of Disease Control and Prevention. Thank you for being here, Dr. Gao. We have Mr. Nabel Goheer from the United Kingdom. Nabel was the Assistant Secretary General of the Commonwealth. He holds a Bachelor of Science in Electrical Engineering and a Master of Arts in International Development. He works for PATH. PATH is a global health non-profit organization located in Seattle in the United States. And we have from Germany, Bernhard Schwartländer. He works for the German Ministry of Foreign Affairs. He is the former head of cabinet of Dr. Tedros, Director General of the WHO. Bernhard also is a trained medical doctor and trained in medical epidemiology. He also worked for UNAIDS and is the former director of the Department of HIV/AIDS for WHO. And he also was representative of the World Health Organization in China. And then we have Mrs. Shamshad Akhtar from Pakistan. She holds a PhD in economics. She is the former Minister of Finance of Pakistan. She also served as an Under-Secretary General at the United Nations, and she was Special Advisor for Economics and Finance for the UN Secretary General, and also Vice President of the World Bank. Thanks for being here. And then we have Mrs. Abha Saxena, originally from India. Abha is an independent advisor for bioethics. She lives in Geneva. She is also a trained medical doctor. She has a 16 years experience in anesthesiology, and she also worked for 16 years as an advisor in questions of ethics at the WHO. And then another colleague, Dr. Ian Smith from the UK. He is an associate professor at Leeds University. He has also 16 years experience in medicine. He worked as a medical doctor in Nepal, specialized in tuberculosis. He then joined the WHO, where he also worked for many years as a special advisor for the WHO. We're going to discuss a highly complex issue. Strengthening global coordination is a very, very complex issue. We're going to first do a tour looking back to the COVID-19 crisis, which is just a few years back. I want to give everybody of you a voice to share with us your reflections on COVID-19 and the main takeaways. George, could you please start by sharing with us what you think about the COVID-19 crisis and what you think you could take away from this crisis.
Well, I think the issue we are talking or addressing here is very important. Look at the session here, stressing the global coordination. We have a lot to learn from the COVID-19 pandemic and from this crisis. Coordination is very, very important. Somehow we, at the moment, in the whole world, we are addressing more on the competition, less on the coordination or cooperation. I think that's a general problem for the whole world, not just for the public health, the global health. It's a whole problem for, the relations among the members of the Earth. By then, we are all living on this particular Earth. What we should learn from this pandemic, we should learn from the viruses. You look at what happened. The viruses, they are coordinated very well. Starting from the prototype, then, we created or we developed so many vaccines in the whole world. And to be honest, the scientists, public health professionals, and also entrepreneurships, everybody worked so hard. We got so many vaccines and also therapeutic antibodies, all these small molecule inhibitors. But the virus escaped. Why the virus escaped? In my opinion, as a scientist, they are coordinated together. They are coordinated globally. One variant by another. And then after variants, they have a subvariant. So this is, I think, the viruses, they learn more than us, than human beings. So I think they first important, they share their data. They know the prototype wouldn't work anymore. Then they have Alpha. Then they realize Alpha didn't work anymore. They created a beta, gamma, delta, blah, blah, blah. Then, the WHO decided to use the Greek 24 letters. From that time, I thought, okay, 24 letters is not enough. No, it confirms wrong. It's right. And then we stopped. In the 15th letter, that's Omicron. So after Omicron, we have this subvariant. So this is my conclusion. For the global coordination, we learn from the viruses. From that, data sharing is first. And then you need strong leadership. We need WHO or United Nations and also local. When I say local, country-based. All the nations, state, strong leadership. And the dialogue, they need to communicate. Not coordination, also communication. Coordination plus communication. We might solve the next pandemic or we might have less catastrophe than what we had at the moment for the pandemic, COVID-19 pandemic. Thank you. I will start with this. Thank you, Klaus.
Thank you. Thank you so much, George. Nabel, what are your takeaways from the last years?
Well, thank you very much, Klaus. Thank you to Boao Forum for arranging this meeting, for the invitation. Very good morning and ni hao. Ni hao. Right, okay. We are discussing health here. We have survived a pandemic. We must celebrate that. Well, thank you for bringing that positive energy. Now, I'm going to broaden, if I may, Klaus, with your permission, this topic a bit. When we talk about our reflections and takeaways, let me start personally. I think what I realized when I survived the pandemic, that my real wealth is my health. I have to look after myself. I will only survive if I'm in good health, if I have good immune system. I don't have to wait for the government to give me a vaccine. So that is one thing which will come my way, but I have to look after myself. And there's a way of saying that, look, you have to save for some rainy days. I live in the United Kingdom. I bought an umbrella. I don't have to work. I don't have to think hard. I can use that umbrella, but I have to save for the next pandemic. That is, you ought to have some savings. So two big lessons from me coming out of the pandemic. So from the personal level to the professional level. Now at the professional level, professionals came together very quickly. Academics, scientists, doctors, engineers, and they were, for all the counter-medical measures for vaccines, there was excellent coordination. As Professor George was saying, perhaps the best coordination which I have seen in my lifetime. So we'll produce a vaccine in the fastest possible way. So I salute them, everybody who worked tirelessly on that one. So cooperation still works, coordination still works at that level. Third one, private sector. Not a surprise. Some organizations made a lot of money, billions of dollars out of that. But there were question marks also of their social responsibility to the society. So that was another lesson or point of reflection for me. Fourthly, governments. I think in a way, governments which were not adequately prepared for this pandemic, their vulnerabilities were exposed. And this was a lesson that you have to be better prepared in the future on some of those things. Secondly, no one government thought, no matter how powerful they are, that they can do everything by themselves. So the interdependencies within governments, that was another one. And lastly, WHO as part of the UN system, I think emerged as another hero at the occasion. It was maligned, unfortunately. We know that the international system is either broken or not very functional, but WHO did a fantastic job of bringing everybody together and coordinating it and having a response. So these will be my 5 takeaways. Thank you.
Thank you so much. Thank you so much, Nabel. Very clear words. Thank you so much. I had an opportunity yesterday to have breakfast with Nabel, and he said, Klaus, let's have an honest discussion. And let's say honestly what's working, what's not working. That's exactly what we try to do in this panel. And I'm going to pass on to Bernhard. Bernhard, what are your takeaways from the last years?
Yeah, thank you, Klaus. Just building on George and Habib's comments, I think what we have seen is an unprecedented cooperation in the development of vaccines, which really is a game shift in global science and global cooperation. It was unthinkable before COVID that we would develop a vaccine from the detection of the agent of the virus to having a product that can be given to people in less than a year. That was completely impossible before, and was possible because the world came together and we sat down and thought, what are the steps that you normally do to get a vaccine registered and give it to people? And all of that, of course, happens one after the other, and each time you lose a lot of time, so it takes years, 4 years and longer. If you do all of that in parallel, you can cut enormous time, but that means you have to take huge risks. You have to build factories before you even know what the vaccine exactly will look like, which factory you can use. You have to actually build several options. So by the time you know which vaccine works, you can choose the right option and immediately do the scale up. And there was willingness to actually do these investments, and we have shown that we can do it, and we got the product very quickly. So that's a huge positive takeaway. On the other side, and you said it before, it really also showed the massive gaps in preparedness in given countries. And I want to just give you an anecdote out of my personal life. And I'm a German citizen. I was working in WHO at the head office, very much involved in every single step of the pandemic. But I was invited by the German Parliament to talk to them about this. And it never occurred to me that in Germany, my own country, and I was in charge of infectious disease epidemiology before, but there never was a threat like that. And I realized that the chancellor, the president, whoever, Minister of Health in Germany, cannot stop a big beer festival not to happen because that's a decision of the local mayor. So there was no way to have a coordinated response unless you convince the local mayor in Bavaria, who has been preparing for this event for half a year, put everything together and says, no, I want to have this thing because it's my party. And there was no system to actually change that. So that's just a reality in countries, and it really COVID displayed many of these weaknesses, and many others. I mean, data collection systems didn't work. Another one, the hospitals. I mean, like, even in my country, hospitals had to save money. And saving money means you cut down on what is most expensive. The most expensive is the ICUs. And because you didn't need so many ICUs, you cut them down, and suddenly COVID comes along and you didn't have ICUs anymore. So you couldn't treat people because there was no beds available. So the flexibility that was then introduced to actually have like, something in between, that you have beds that you can actually shift from one thing to the other. I mean, all of these are lessons which are incredibly important, displaying the weakness and seeing how we could overcome this collectively in different countries. And so these are just two examples. Now, the most important lesson for me to take away, and that's again a less positive one, is how quickly we came in a politicized discussion where blame was more important than a scientific exchange, and eroding the trust between countries. And I think that's a topic, I mean, a word that always comes back to me whatever we look into how we go forward with the pandemic treaty and everything. If there is no trust between countries, between people, then there's no sharing of information. People hold back because they're afraid. If there's no sharing of information, the virus wins, because the virus shares information, as George said, I think very graphically. And I think we have to really think how we build the systems, and it's not a mechanical thing, but how can we build networks that sustain the pressures and the tiering, of interest groups to sustain that and actually make sure that information flows, the information that's vital to actually, mount a response that protects us from the next pandemic. So that's my main lesson.
Yeah, thank you so much, Bernhard. You bring in a component which is profoundly human. How can we trust each other when it's about coordination? With your background as a former minister in finance in Pakistan on a top government position, Shamshad, what is your impression now looking back on the COVID-19 crisis?
Thank you very much, and thanks to everybody out here. I think it's important to understand that I come from a very different background. I'm not a medical specialist, so my own assessment is that we have been 75 years after WHO, and I think we needed to do much more on trying to encourage cooperation, coordination, and solidarity in the global health institutional architecture, because it has now become very fragmented. It's very confused in my view, and it is actually quite inefficient from a collective oversight that I have looked at. Health systems, organizations, and platforms have overlapping and often non-aligned mandates and operate in competition with each other. And that doesn't serve well because you undercut the funding also in the process. So in midst of this, COVID-19 revealed many of the weaknesses in the system. And sometimes it's hard to track, but it also created an opportunity to initiate once-in-generation reforms to consolidate and harmonize arrangements. And that is a real opportunity because you fumble through it and you find there are solutions also. So to me, central to any reform effort requires a resolute, unwavering commitment to multilateralism. not just an ad hoc response. And it has to be supported by real practical measures to ensure a better prepared world for future for delivery of holistic health and emergency services caused, of course, by pandemics, climate change, and biodiversity loss. So 3 elements are quite critical to hang on to it. Now, to deal with the next pandemic is a responsibility and a challenge for the international community. It requires timely and effective crisis response. And it requires a prevention system to address global coordination and health emergency. Underlying it, again, I reiterate, multilateralism has to be at the forefront of the health system reforms to build inclusive alliances, to uphold its value propositions. Now, will the pandemic agreement proposed by the WHO speed up the reform of the public health delivery system or not? Will, of course, the jury would be out, but it does require legal protection for public health emergencies in future. We have to ring-fence all policies, innovation, universal health coverage, and consensus on the resolution of COVID-19 preparedness and response. We should be working collectively with all the countries for development of health undertakings in China, Asia, Africa, of course, and the rest of the world. Global economy can actually do something much more also in terms of helping us generate jobs, which is what we also need. So that's another positive takeaway. There's got to be global industrialization, liberalization, and so forth. Lots of things that need to be stacked in. We need to promote e-commerce, and e-commerce retailers are beneficial to the development of small and micro enterprises and establishment of digital currency cross-border settlement and payment system, which will promote the reshaping of today's trade settlement system. I think this is a very critical element from my work in this area. We, of course, have to generate a lot of data, but given that it's a pretty long-winded thing, I'm not going to go too deep into it unless there are questions. And eventually, we have to have various country and groupings, particularly the World Bank Group, which has been very instrumental in coordinating emergency responses that have changed the way in which affected countries and international agencies view themselves. So we have to have adoption of One Health approach, conceptually consistent with the commitment of health, nutrition, and population, global practice groups. One Health is ultimately an approach that supports sustainable development. And I think World Bank can glue in much more if we can figure out a way that it reinforces One Health approach. The EU, UN, Australia, Canada, France, Netherlands, UK, and so forth. So I'll stop here. I think the point here that I'm trying to make is we have to find innovative solutions to be able to get more effective results. And there are a lot of opportunities in what I have tried to explain. So I'm going to stop here, but I'll come back to a lot of questions.
Thank you so much. For me, it's always a great pleasure to listen to politicians who have knowledge and commitment, and who also have the time to express themselves. In the media, sometimes we just hear a few seconds statement, and it's not representative. So you have a very detailed vision of what should change. You mentioned multilateralism. We're going to come back to that later, because that's not an easy subject either. Yeah. Thank you so much. Let's move on with Abha. What's your thinking about what happened the last years?
Thank you, Klaus, and I thank the organizers to invite me to this panel. I also thank the previous speakers for having said a lot of what I thought I would say, so thank you for that. But I'd like to say a couple of things more that add to what has already been said. I come from a bioethics background, so some of the things I'm going to say are bordering into that area. One of the things I noticed almost at the beginning of the pandemic was, WHO has a lot of guidance on how these things should be managed. But that guidance was never used by countries. And it was at some level also not used by WHO, because there are departments which don't talk to each other necessarily. So we know that guidance exists in one department, but the other department doesn't know. So we need to talk much more. Communication is key. Sharing not only data, but sharing information and sharing experiences is key, which we don't do as well as we could. But I also want to say that one of the things we didn't do, again, from the WHO perspective, WHO had just finished managing a major epidemic which included 3 or 4 countries in Western Africa. I'm talking of the Ebola crisis. There were a lot of lessons learned from there. I think a lot of lessons were taken into consideration, especially sharing of data that happened very effectively. The first viral information, the information about the virus was shared within days, if not hours, with the global community. So all those things happened. But there were a lot of other smaller lessons that were sort of forgotten, and therefore everyone was scrambling to put together a response. So I think my takeaway is that we need to prepare more diligently during peacetime, when there is no pandemic, there is no stress about things. There should be a very diligent preparation for the next pandemic, not knowing what's going to come. So there should be a whole lot of scenarios, and not only at the international level, at the regional level, national level, subnational level. So it should be a sort of as though a crisis is going to happen tomorrow. And because we say that, it's not when the next pandemic will happen. It's not if the next pandemic will happen. It is when will it happen, and it may be in the next 10 years. We need to be prepared now. The second thing is about trust, and I think, Bernhard, you talked about trust. And for me, trust is extremely important, because trust allows people to talk to each other, to listen to each other, not only at the international level, at the national level. If 2 ministers at the national level don't trust each other, they will not share information. And if communities don't trust information and don't trust each other, then they will not help each other. So we need trust at every level. And that's hard to build, but it's possible, especially it's more possible if, for example, if there is transparency. Transparency in the sense that if you don't know something, please let people know that you're making decisions, but you really don't have evidence, but that's the best you can do at that time. And that as you get more evidence, you will change your recommendations. So it's a fluid situation, and one should be prepared to acknowledge it's a fluid situation. One should be prepared to acknowledge one's lack of information or lack of evidence. And one should be able to say, well, we're all in it together, let's do things together, rather than I'm asking you to do so. So I think there's this thing about being humble enough to acknowledge that we don't know. So that is the second thing about transparency. acknowledging uncertainty, preparing during peacetime, and trust. But one big elephant in the room is about equity. We saw a lot of inequitable sharing, not only of data. In the beginning, there was a lot of very good sharing, but as time passed, people said, "Oh, I don't want to share some things because if I share, then I get penalized." So they're not good enough rules for equitable sharing. But also, this inequitable sharing happens not only at the international level, it has happened at the national level, again at the community level. So people who are the most vulnerable have suffered the most. That's because no one pays attention. Well, people do pay attention, but less attention is paid to the most vulnerable people of our society. And if they are not safe, then nobody is safe, as was said for the pandemic. So I think equity is a major thing that we need to work much more on that and how to do it. So I'll stop here because I think a lot has been already said.
Yeah, very important contribution. You mentioned transparency, equity, also coordination. There has been a lot of work done already before the COVID-19 crisis, but do people within different organizations know about the work of the others? So also there's an issue of communication. I'm very, very happy to hear in a very open way here people talking about what did not work, because that's really the very base to build something better in the future. When I look back what happened during the COVID-19 crisis, it was very difficult to admit for people who have had responsibilities to say what's not working. The pressure was so huge, and the pressure in the media was so huge too. But we're going to talk about this later. Ian, what are your takeaways from the COVID-19 crisis?
It's hard to add a great deal more to what's been already said, but let me try. I'd like to reiterate that first point that everybody's raised, that we simply were not ready. The world was not ready. Or perhaps we should rephrase it a little bit and say the world was ready for the wrong pandemic. We put a lot of effort into preparing for an influenza pandemic, but it wasn't influenza. It was a different virus that created different problems. And unfortunately, that wasn't recognized early enough. But yeah, in effect, we weren't ready. I think my second message would be that although it was a pandemic of a virus, every pandemic actually there's three concurrent pandemics occurring at the same time. The first is the virus itself, of course, spreading very rapidly. But equally quickly, there is a pandemic of fear that spreads. And any pandemic of fear creates a pandemic of misinformation. And those three pandemics were ongoing at the same time. And we focused very much on the first, getting the virus under control. And it took us a while to start really working effectively against the other two, and to deal with the pandemic of fear and the pandemic of misinformation. I think my third message would be leadership matters. And what we saw was that very often the first response was the wrong response. Politicians and others did things that really weren't helpful or appropriate in the early days of the pandemic, and sometimes even later on as well. What we saw, too, was that those leaders who were consistent, who were science-based, who talked to their people, were the most effective and the most successful. And I would argue, and I think everybody else would have said at the same time, women leaders did a lot better than men. I think my final message in terms of what we learned from the pandemic will go back to this issue of trust, the pandemic of mistrust that was created through misinformation, but also not just through misinformation. I think we've got to recognize it wasn't just trust between people, trust within communities, trust in authority, trust in science that was undermined. it was trust between countries. I think, Abha, you mentioned this. And that trust that was broken between countries was largely because of the inequities that we saw, particularly in terms of access to vaccines, but also in other ways too, in terms of resources and information. And I think we've got to recognize that when we break trust, it takes a long time to rebuild it. We can't just assume that once it's passed, it's over and we can go back to trusting one another. It doesn't happen like that. And I think one of the unfortunate casualties of the pandemic has been that profound distrust that exists now between North and South, East and West, and it's demonstrated in many different fora, including the current negotiations on the pandemic agreement. There has been, obviously, a clear lack of trust. Countries are not willing to accept simply what people and what countries, what leaders say they will do, because they know that they won't actually do it in practice. And that, for me, is deeply troubling, because that's something we've got to work hard at rebuilding. If I may, finally, one final point, which isn't so much based on what we learned during the pandemic, but what we've seen afterwards. And that is that we have incredibly short memories. We've forgotten so much of what it was like during the pandemic. And as a result, there's a sort of almost a laissez-faire approach. We're not really that bothered as much as we were at the time. And what we're in danger of doing is getting back into these cycles of panic and neglect that have characterized the global response to previous pandemics and outbreaks. We had swine flu in 2008-9, we had Ebola in 2014-15, we've now had COVID-19. Will we do any better next time? Well, let's see. But unfortunately, these cycles of panic and neglect don't give us a great deal of confidence at this stage that we will do any better in the future in stopping a pandemic.
It's so true what you're saying, Ian, that we take trust for granted, but once it's broken, it's difficult to rebuild. In order to fix a problem, we need first identify a problem. And when it's about epidemics, we need somehow a system that allows us to identify where is a potential threat. I want to share an experience I had myself about 15 years ago when I was working in Central Africa. And there was a time we had coming in a lot of meningitis cases, people with high fever, red eyes, stiffness in the neck, and I was living in Africa with my family. I had a young child, 2 years old at this point, and we were planning to go back to Europe. Actually, my wife was planning to go back to Europe, and I drove them to the airport, and the day they were flying out, my daughter was not doing so well. It was a very hot day, and she didn't drink very much, so they went on the plane of Air France, and the plane was ready for takeoff. And my daughter was crying, and suddenly the stewardess came and said, "What's going on with this child?" And my wife said, "Yeah, she isn't doing so well the whole day." And she mentioned that we came from an epidemic area, a meningitis area. Air France took the plane back, did not take off. They had to go off the plane. 6 hours later, the plane took off and flew to Paris. And for the first time, I got an idea of how quickly a problem which is local can go global. So I have a question to Ian. You have been involved in a monitoring system which is called the Global Preparedness Monitoring Board. Can you tell us about this board, please?
Certainly, and thanks. I've had the privilege over the last 3 or 4 years of supporting this Global Preparedness Monitoring Board, which was established following the Ebola outbreak of 2014-15 in response to a global or a high-level panel for Global Health Crises, which was established by the Secretary General in 2015. And the idea of this Global Preparedness Monitoring Board was to establish an independent body that would look at the state of the world's preparedness for health emergencies, determine to what extent the world was ready, and then make recommendations on how to strengthen global preparedness. It doesn't focus on the national level, it focuses on the global level, on effectively what is all about the coordinated response to a pandemic, to prevent it, prepare for it, and then respond to it. It was initially established by WHO and the World Bank back in 2018, and it was co-chaired by two extraordinary people, Gro Harlem Brundtland, the former Prime Minister of Norway, and Mr. Aisa, the former head of the International Federation of Red Cross and Red Crescent Societies. Absolutely two extraordinary people with a wonderful group of board members, including George at the end there, who was part of the GPMB in its first few years as well. And in September 2019, it produced its first report to the world on the state of the world's preparedness. And the title of that report was A World at Risk. And what it was saying was, you are not ready. And it warned of the risk of a rapidly moving respiratory virus that would cause a pandemic and would have immense impacts on health, but also on society and also on economies. That came out in September 2019, and its conclusion was, you're not ready. And just 2-3 months later, it was proven to be right. It was prescient in terms of alerting the world, you are not prepared. And despite that warning, and despite all the recommendations the GPMB made at that time, basically nothing happened, and we saw the consequences. We've produced 3 reports since then, 2020, 2021, and 2020. Sorry, 21 and 2 reports since then, 2021 and 2023. The 2021 report, I think, is really important because what it said was, you're not ready, and this is what you need to do. And it looked at preparedness from 2 important dimensions. The first is the human dimension, in terms of what we need to see in terms of strengthening leadership, first of all. But then on the other side, it's what do we need to see in terms of the public? Because I think we often forget that the public, in fact, always make the first response to a pandemic. It's not governments, it's the public. It's what people do that matters. And it's that public preparedness which is so critically important, and the importance of having community engagement, community ownership of a pandemic response. And then the second dimension it looked at was that of systems and financing, systems and their financing. What are the systems that we need to put in place, and therefore what are the resources we need to put into them to make sure they're ready? And where these 2 axes interact, the human dimension and the systems dimension, at the center of that is governance, good governance. What do we need in terms of good governance to make sure that all the resources that we're putting in, all the systems that we've established, all the leadership that we need, and the community response, how do we make sure that it all comes together across all countries effectively? And I think those recommendations that the GPMB made in 2020, 2021, and 2023 are still absolutely relevant and important today.
Thank you so much, Ian. Nabel, what's your idea and opinion on how good are our institutions today to respond to global public health threats?
Well, thank you. Great question. And I was still taking notes from what Ian was saying. How good is the system? I think when I joined the sector myself, the very first thing for me was to make sense of the global health sector. So in terms of systems and institutions, it was perplexing because I found it very complex as well as crowded. And the way I make sense of the system, comes first before I comment on that one. So the first thing which comes to mind is WHO, health, which is one of the many actors within the system, part of the UN system, which reports through ECOSOC to the UN, but generally normative body, standard setting, global coordination, everything which we have been discussing here. But WHO is one of many players. And I was there for WHA 77. Now they have rolled out a plan asking governments for $11.1 billion. And I'm talking about finance, especially because this will give you the scale and stage in which global health operates. 11.1 perhaps for 5 years, for the next 5 years. So that is one big part of the system. Secondly, you have global health initiatives, or so-called disease verticals, or system-level institutions. You have Global Fund for malaria, HIV/AIDS, as well as for TB. You have Gavi, you have SAPI. So plethora of institutions which exists dealing with infectious diseases. So specialized institution of the UN on AIDS, then UNITAID. So there are a number of other institutions which I call the second-tier institutions. The third one will be governments, donor governments. US alone, for example, contributed $100 billion, which was called the US President's Fund on HIV and AIDS, PEPFAR. $100 billion. So compare this with 11.1 billion for 5 years for WHO, FCDO, German government. So these are big players in the system which contribute a lot, but that is more bilateral and not multilateral. A lot of it is bilateral. Then you talk about multilateral development banks. Again, global health, and we are one of the players in that one, when we try to make sense of it, is that global health is close to $87 billion per year business. Multilateral development banks lending, all 12 of them, including Asian Infrastructure Investment Bank, World Bank is the largest player, is equivalent almost $90 billion. So slightly more than what you have in terms of other systems. So this is the four facet of the global health system. Then in terms of direction setting, there are institutions which are there which influence both policies as well as financing, which is G7, which is G20. So they discuss it, make decisions, and those decisions then influence the policies of these so-called multilateral institutions. And if I may say so, I promised to you yesterday over breakfast that I'll be honest, G2, which is not really visible, but its effects are very, very visible. We are talking about trust. We are talking about global coordination. We cannot forget the geopolitics, the big umbrella in which everything works. So this is the fifth dimension of global health institutions. And last one, philanthropic institutions. And they are not small. Bill Gates Foundation alone will contribute close to $8.6 billion in global health, which is going to be $9 billion from next year. Rockefeller Foundation, Wellcome Trust in London, 1.9 billion pounds every year. So when I made this point that the entire system of institutions is complex, the field is crowded, it comes back to the point, beautiful point, which was made at the beginning by Professor George, and that is, who is coordinating that, right? And the point which Dr. Akhtar was making in terms of bringing it all together, this duplication which is happening. Now, let me just focus out of all of this, when the pandemic started, on the pandemic institutions. I recall I rushed to Germany because Angela Merkel, at that time Chancellor, announced this global intelligence hub, which now exists. And we were the kind of technical experts working with them. Then there was G7 meeting in the UK. So the then Prime Minister from the UK announced a pandemic radar. Rockefeller Foundation said, oh, we're going to have a pandemic institute. So what happens is that there's a bandwagon, and that effect is everybody wants to do something, and then they'll jump in without coordinating or consulting with others or what others are doing. So this tells you the state of global public health, its systems and institutions. I wouldn't call it broken. It's fragmented. It's not coordinated. It has a huge potential. We know the problems, but to get to the solution, I think first we have to understand the jigsaw puzzle and have the allocation of responsibilities and the trust of governments and publics on those institutions of who will lead in doing what. So I'll stop here.
I hear you saying there's a huge lack of coherency. That's basically what you're saying. We live in a highly technical world, and technology probably will have even more its place in our society. How much can technology help us to improve the institutions we need and to improve dialogue and to share data? George, you as the former director of the Center for Disease Control, what's your opinion on the importance of technology and how to improve institutions through technology and sharing information through technology?
I think, during this pandemic, we all realize that technology did work, I should say, use the word very well, technologically. We had, as I said, we had a vaccine and everything like this. And also in so many countries, you also use the word health organization. Now we have TRIQUI, work based in Berlin. We also have our own monitoring and data sharing center under WHO. So technology is always there. What I would address here, we should also realize, sometimes you need to walk away a little bit from the so-called crisis. Think about the chance the crisis provided to us. The technology provided the chance for us. Think about if we didn't have this pandemic, the whole mRNA technology will still be in the lab, never be realized in the clinics. But now, I can foresee. So we will have cancer or tumor-related mRNA products very soon, popularly used worldwide. So, sometimes we should think about something else instead of always focus then on that, because pandemic never been a technology problem. Pandemic is very complex. Technologies, that will be solved by the professionals, and then, politics. Once everything is politicized, it will be very, very hard. And then also need the public to help. When I say public help, public must try to understand well. Public understanding, public involvement is very important. All those, it's very complex. So in terms of technology, again, I think, it did a very good job so far. And I want to make more comments about Yan's 3 pandemics. Those three pandemics simultaneously. What I want to stress this more, in addition to the technology. Think about it when we have a lot of, most of you are Chinese. Let me put this word. When the Chinese are the professionals, in Chinese, it means 专家, professionals. During the pandemic, you have a lot of rumors, misinformation, disinformation. All the professionals were described badly as someone who line, and behind or line on the brick. That's a Chinese word, 专家靠着墙做了，靠着石头 means, it's a professional who line on the brick. That's a Chinese word. So that means they don't, this is what Yan said, also everything about the trust. If, the distrust there, as you also comment, it will be very, very difficult to get it back. You know, from this time, I think the technology, think about the mRNA. mRNA helps us a lot. We need to think something more positive than the negative part. By the end of the day, we also should realize we are just one of the living lives on the earth, only one of them. You know, we are tiny compared with billions microbes. Who are you? You are one species. Don't forget, we are only one species. We think we are so clever, we are intellectual. So this is why we named ourselves as Homo sapien. Sapien means intellectual, clever, wise, right? We think we are wise. In fact, we are not. You know, this is why I think, you know, again, by the end, we still need to trust the technology. We still need to trust the professionals. You know, they will help us to solve some problem. But for the disinformation or misinformation, so-called infodemic, we also should tell the public, technology or science has its own limitation. Don't tell the public, okay, the science and the technology will solve all the problems. You know, you will eternal, you will live for forever. The longevity, 120 years, 200. So that's not a human being. Maybe something else. Maybe some microbes, some other species will live for 100 or 1,000 years, like turtle or whatsoever, right? So this is, you know, again, the question you ask me, my comment, you know, we must trust the technology. But we should also realize the limitation of the technology. Thank you. Oh, by the way, I want to make another comment. I forgot I made a note about me. Because Ian is the secretary, Secretary General for the GPMB. I was a member. Ian mentioned about the September 2019's annual report. That's the first report. The world at risk. There we claimed, because I was a member, you know, foresee the future, we will have a pandemic. We don't know where, we don't know where, we don't know when, we don't know where it will initiate. But definitely we will have a pandemic. The board recommend, most likely, 2 viruses. One is flu, the other one is coronavirus. So for coronavirus and flu virus, we already know it will be the next pandemic. I can see here, for the next one, we will have another flu or corona. Again, those 2 will be the top list. Thank you.
Thank you, George. Thank you. Bernhard, what do you think, how technology can help us to build a more coherent and appropriate response, and not just in identifying a problem, but also sharing the information? And what are the obstacles in sharing information?
Yeah, there are many opportunities, but also many obstacles. But I think the Berlin hub on pandemic preparedness was mentioned, and I had the pleasure of conceptualizing and starting it. And I say this only because there was a vision behind. And the vision was exactly that. What are the systems that we have to build to make sharing more effective and more stable and less prone to risks of interference or false information? And also by utilizing modern technologies which we hadn't used so far. When I first joined WHO, the transmission of information was via fax, a fax machine, and that was a breakthrough. Right before that, it was sending letters. It's quite some time ago, but I raise this because it fundamentally describes that information sharing at its roots, where we all come from, and still until the times of COVID, was basically somebody sending actively information somewhere else. Then that somewhere else does something with it and gives guidance back. So it's a hierarchical way of sharing information, which is prone to massive interference in many ways, right? Somebody gets stopped by sharing information. You turn off the fax machine, or you cannot technical people, I was not allowed in WHO as a fairly senior officer to send the fax. I had to get the fax signed by my director. You remember that? Yeah. So if the director doesn't like it, the fax doesn't go. So just a very silly example, but it's an anecdote. Now, similar things happen, of course, with information being shared in an epidemic and in COVID. I mean, if people get insecure and maybe the local director is afraid if that information goes out, it's not entirely clear, and maybe it's wrong, it's not really such a bad thing, then I look bad and I get fired and whatever, I get problems. So let's not do it. Let's wait. Now, what is much more and is happening elsewhere is basically sort of the systems with artificial intelligence and crowd intelligence, I want to say. It's basically collecting information from the source and connecting the different source points with each other, because that stabilizes the information amazingly. And not only that, it allows a local professional seeing something that's strange, sharing it across in a network with others who may have seen something as well. Then get back and say, well, I had a similar thing. Let's look into that. You very quickly have a completely different dialogue, which is much more stable. It's a network, and if you pull one knot of a net, you still have many other knots that hold. So that's a little bit, I mean, at a high level, the vision also behind the Berlin hub. How can we use, how can we build such a network which builds with swarm intelligence, which connects the dots with each other? And I always have the picture in my mind, because that's what happened at the same time, is if you send all these drones up in the air and do these nice, beautiful pictures that we see with the lights at night, right? Beautiful things. And China is just marvelous in doing that, the Chinese companies. But if you try to control every single of these 1,000 drones flying up there from the ground control, you will fail, because there will be one drone that loses connection and hits the next drone, and the whole thing collapses. It's sort of a chaos. So what you have to do is you have to connect the drones with each other. At minimum, you have to tell them, don't get closer than this. And if you get closer, you shut off and you disappear, right? These types of things. That's a very simple example, again, but connecting people with each other is, I think, the key in how you stabilize networks to deliver data. Now, a second point linked to that is that what happened is that the politicians get advice from their technical people. If we can make sure that the technical people are all connected and sort of speak from a similar songbook, it's much more likely that politicians will act the same way. Now, there's absolutely no guarantee. Politicians are politicians. They may choose to say something else, and we have seen that happening. But it's much less likely that that would have the same effect, because everybody is more connected and maybe thinking before something is being said, which is not so smart. So, I mean, that's a little bit the idea behind building interconnected networks of people on the ground, of scientists, of doctors, to share information and have a much more stable network and a net to actually let information flow.
Thank you, Bernhard. But I want to stay at this point, because what you're saying is we need to develop more a horizontal approach, allowing us the clinicians to share what's happening in one country and pass on the information in another country, and there are borders between countries. And I think it is hard for sovereign states to protect their interests on one side and to make the stretch towards what is important for a global collective community. That needs dialogue, that needs vision. Where are we when it's about sharing information between nations currently? What's your opinion on that?
I think one addition to what you said is that we need to reach a state where the leader of a sovereign country, and sovereignty is certainly a principle which rates extremely high. We cannot interfere with that. But unless all these leaders recognize it actually serves their own purpose to share information, that this information is shared, and it serves their own purpose, the life of their own people, their own life. Because through sharing of information, through science, you can actually protect yourself better, right? And unless we reach that stage, we will not succeed. That's the problem. So I think it's really a complete shift in thinking for leaders, for organizations. It will be a challenge for an organization like WHO to basically go away from a purely hierarchical system to one that's much more horizontal. And I'm not saying that you give up responsibilities, you cannot. WHO is the world's normative agency on health. And without WHO, we wouldn't have guidance. That's universally accepted. I think that's the problem. And there's no way. But there are different ways of achieving that. And there's a classical way, and there will be new ways. We have to embrace new technologies to make that work even more powerful. And how to do that. And it's a similar way of rethinking, like the leader of a sovereign state, and said, my decisions will be better, and the work that I do for my people will be better if that happens. Now, the politicians still have to take their decisions, but it will be much more transparent, it will be much more clear. I mean, you can say, I disagree with that as a politician because there are other arguments that I need to consider as a politician, and that's correct. I mean, like a finance minister has other arguments. And if I may, just a very small thing, and I'm very glad to sit next to a finance minister. One of the big failures, and I personally was so frustrated when I sat and tried to move on that, the fact that when we had, at the height of the pandemic, the rich nations, created all these economic stimuli in trillions of dollars to keep the economy stable. If we would have taken 1% of that, just 1% of all these stimuli, it would have been enough to give every person on the planet a shot of the vaccine. We never entered to that discussion effectively. We kept in the realm of health and development, which is very small pots of money. And I only put this out because if we continue to think that the pandemics are a medical issue or development issue, we will fail. It would have been the most effective way to protect economies to vaccinate everybody. But we didn't manage to really make that shift, and therefore we got stuck. We didn't have enough money. It goes a little bit back into what actually makes most sense, what makes the biggest effect, and that should be based on science. And the most logical thing would have been, let's take that very, very small share of the total and do actually what's most effective to protect the global economy and vaccinate people. But that thinking didn't come through.
Thank you so much. There's a huge educational component to that. People have to understand the bigger picture and the priorities. But coming back to after having identified a problem, and then we go into decision-making process, whatever the decision is, let's say vaccinating people or testing or whatever, there are some ethical aspects to the decision-making process, because what we decide finally has correspond to ethical values and also has correspond to human rights. Abha, you as a specialist in ethics, can you tell us about how you, at the end of the day, develop ethical guidelines in ethics, so that we can correspond in a most human and coherent way to a global public threat?
First Abha, and then well, everyone is ethical here, so I don't hold any specific functions for that. But still, talking about how do you develop guidance for the world, it's not easy. And especially like we had to do this for Ebola, for example, in WHO, to develop guidance for managing epidemics, ethics guidance. And the question was, who's developing the guidance? I mean, can we develop guidance sitting in an international organization and bringing it down? And no, you cannot. You need to hear the people who are affected by a problem They need to guide you in developing the guidance. So the first thing I would say is listen to people, engage with people at all levels. The politicians, what are their problems in managing an epidemic or a pandemic, and how can we guide them to take the right decisions? But also listen from the technical people. What are they saying about what matters? Is it more important to have, for example, antibiotics to manage an epidemic, or a vaccine, or prevention of personal protective equipment? So what are the things that matter to technical people? What are the things that matter to the common people? So I think to the patients who suffer, to the healthcare workers who have to provide services. So before you even start making a guidance, I think there should be an engagement with all these communities and listen to them from different countries, from different backgrounds. And WHO is one organization that is absolutely suited to do this. We are able to provide a convening platform. I'm saying I no longer work for WHO, but WHO, I worked there for many years. There is no other organization that can provide that sort of a convening platform where everyone can sit together and talk without fear of repercussions or very honestly. And so we did that for the guidance development. When we developed guidance for the epidemics, we had nurses in the room, we had politicians, we had ministers of health, we also had healthcare workers, technical people, and we were guided by the evidence that existed. So there's a big review of literature that was carried out. The evidence guided that. So you have one factor, which is the evidence, the other is the voices of different people. But importantly also, you say, okay, what are the values that matter to us when we are developing this guidance? Do we put more attention to, you can have a list of 18 ethics values, but you can't have a guidance which is bound by 18. It's too big, it becomes very unwieldy. So you have to identify which are the 6 or 7 important values, and whether other values can be can be bounded by one value, and that's possible to do. But then it's not WHO which decides. It's the people on the table. They might rank values. They might say, well, this is more important, this is less important. And it's a question of, it's not something absolute. So if WHO, for example, comes up with 7 important values that need to guide a pandemic or an epidemic, CDC China may say, well, we think of 5 others which are important, and that's okay. But I think they should be able to justify why those values are there, why they are important. So it's a sort of a game that goes on, but in the end, people sort of around the table will agree, and then you need to test it. So you send it out to the whole world and say, look, these are the things that we think are important, what do you think? And there is a process of negotiation. At the end, we can come to a conclusion. We have done that in the past. We've done that for the pandemic now. Or, well, we are trying to do it with the pandemic treaty, and we haven't completely succeeded. But I think that's a game that needs to happen. And that way you can, then get down to the business of what is the guidance. Because your values will decide what sort of principles you want to have and what sort of policies. So your policies should be guided by your values. So if you talk about, you say equity is a value that we consider important. It's not only equity at the international level, but equity at each level. And then also equity, by equity I mean like this fairness and in distribution. So it's not only fairness at the international level, but at the national level, is everyone being equitably treated? So it trickles down. But then when you develop the policy, you need to make sure that when you say a policy for distributing vaccine, is it guided by the value of equity or not? And this didn't happen in this pandemic. COVAX, when they were saying, well, we need X amount of money for the low and middle income countries and we need to distribute the vaccines, unfortunately, they were looking at, let's give everyone 3% of the needs. But 3% of, no, let's say give everyone 3% of what, and it was not based on need. So it became a bit of a problem, which eventually was corrected, but, there was a delay. So I think if they had the values written up and then developed policies which were consistent with the values, that might have been more helpful.
Thank you so much. Shamshad, I'm so happy to have you here as a top politician. For me as a medical doctor, it's a quite easy job. I have a patient, I'm doing what I'm doing every day since 25 years in different countries. But when you listen to people like Bernhard next to you and Abha next to you, you get information from a field you're not familiar as a politician. And you need to bring together all the different experiences and opinions, and then you have a political party behind you as well. So for you as a politician, it must be very difficult to, first of all, have a trustful relationship to those who advise you, and then from there to take a decision and to put it into place and also justify it in the media, because it's another layer we have not discussed yet. So what is your experience when it's about taking decisions in fields you're not really familiar because you just have not dealt with that?
Right. So there's so many aspects to this question that it'll have to be dissected, first of all, from what I see. For one, I'm not a politician per se. So for me, everything was technical. And I think it's important to understand from where the financing discussion started. It's at the end of the day, it's all about finance, more than anything else. If you have the money, you can pump in more and more. If you don't have the money, you have to be extremely prudent in how you deploy that funding. So let's step back a little. When this crisis broke, I was, first of all, with Secretary General Ban Ki-moon. And it's important to recollect that. Me and Secretary General Ban Ki-moon were instrumental in raising the first large amount for what we call the GCF and the related. I still remember me and Ban Ki-moon were part of the G20. We are part of the G20. So I'm the Sherpa as well as the finance person. And of course, Ban Ki-moon is the Secretary General at that time. So Secretary General and I went from one politician to another, to another, to another. Are you going to commit resources for this? And it is shocking how bad it was, frankly. I'll be very blatant about it. And Secretary General, if he's in the corridors, which he is, will be the first one to admit what a hard time we both had. And every prime minister had an excuse why not to give the money. And the most forthcoming, of course, I have to say, was Japan. So, Japanese Prime Minister, unfortunately he's no longer with us, contributed about 3 billion, which was like for Ban Ki-moon and myself, the first breakthrough on political finance. I think this is a very important incident in my whole career, that we are talking about such a major crisis. Sustainable development is back about 15 years, and nobody is forthcoming with political money. In any case, to cut the long story short, we had a strategy to continue concentrating, And the next one, who was pretty decent, was, of course, the American president. He laughed at me, and I tried to give him explanation, and so was Secretary General, and he basically said, I know, she's the brain behind you. So I listened to her. So, there were lots of jokes in this whole thing. And he said, we have to all contribute. So he was my second in command in getting support from him. And the story can go on. But coming to the finance issue, I think it is very important for us to understand that nothing moves without finance, nothing moves without political finance, and nothing moves with economic push in this whole thing. And G20 did not play a very positive role initially, but then subsequently, now what we were just discussing, the 2017, the round that has resulted in raising much more money was eventually the economic impetus coming from the delays in sustainable development implementation. And that is critical because you have to have a track of finance that is dealing with three critical issues. One is, and this is an important distinction, one is to understand that we had a crisis. It was stop, go, stop, go, stop, go. But ultimately, dollar appreciation happened within the context of that, which is a massive issue. And there is whole dynamics about it. And then there were local conditions that were determining. And then you had a push coming from release of money, which came from, of course, the impetus that came from, sorry, there's something in the thing. So then another impetus that came was, besides, I think there's some noise that's getting to my ear. It's okay, it'll just settle down. So the other impetus that came was the release of the funding that was needed to provide the financial impetus in a different manner. And let me explain that. One is coming from the, I don't know what this noise is about, frankly. It'll just settle down. Just give me, no, it's just, it'll just settle down. So let me try to recollect my thought. One is the pressure of the countries themselves to go up and down. It is happening, it is not happening. Second is to get fixated on the dollar appreciation. And the third is to have a financial impetus to release more money into the system, which was very critical. Some jurisdictions basically took the view that we have to have effectively a faster response to the actual crisis itself. Like, some of the localities decided that we have to move with a major impetus in terms of the funding. Like, Pakistan in particular released quite a bit of money in different localities, and he would know that. So these three factors were playing a very important role. And it was really the dynamics of these three factors which were ultimately determining the actual release of the funding until you reach 2017, where there were, 2017 and then furthermore, where there was a very decisive action that was taken by a lot of countries that we are going to collectively go for a larger amount in terms of the release of the funding. And that was a very decisive impetus to the funding itself. So let me now keep that aside and come to the real second track issue, which is basically that unless and until we sort out the G20 matter, we're not going to get anywhere. And within the G20, there are those who support, and then there are those who don't support. And the G20 can freeze it, and the G20 can release it also. Now, within the G20, the opposition that you ultimately get is that we don't want to do it this way, we want to do it this way. And that can be very detrimental, because you have to allow the system to work. And allowing the system to work means that you have to pump in much more money at the end of the day in areas where it is needed. So the G20 took a very strange position at very critical times that we are not going to go forward with it. And that was a major setback, in my view, to the actual release of the funding. Now, you'll ask, what was the real issue? The real issue was that I am only going to spend this money for purposes of XYZ. But you know, the G20 has to let it go. Whether we use this money to deploy fully, or we deploy part of it. If you don't allow that, the system will not work. So I think, to cut the long story short, taking from his point, it is important to have G20 go for it all. And that means we have to make sure that we release the funding that is absolutely required and not apportion it. Because apportioning can be much more destructive. So, okay, so let's leave that for a while. And I think there are other dynamics too that are very important to recognize. First of all, I think we need to recognize that we need to give more money. Can you hear me? So we need to give much more money to the areas where it is needed, which is related to effectively the dimensions that are critical to the G20 process itself. And the 2017 was the statement, if you look at the 2017 statement, it has it all there. That you have to first start spending in this area, then you start spending in this other area, and ultimately you get the equation going for it. Now, keeping aside the money part of it, I think we have to also look at the quality of where the funding goes. And the quality would very much depend on where ultimately we all work together to cycle this money. And if you take a very strong position, I'm not going to spend this money in this area and I'll spend this money in this area, then the system will not work effectively. So that was the synthesis of where it came from.
I see. I see the importance of having the ability to think systemically, really to put together all the different aspects, and then there comes leadership. Leadership is needed. Where are we heading in the best and most coherent way, not just in terms of national interest, but global interest? Nabel, you as former Assistant Secretary General, right, of the Commonwealth, when you talk to a lot of politicians, you talk to prime ministers, ministers of health, and all sorts of ministers, what's your impression that, do you have the impression that these people who, at the end, a pandemic is not just a medical issue. I think George said that. It's a complex issue involving many different aspects. Do you have the impression that these people who are making decisions on a high political level do understand the complexity of the problem?
Well, this is a $1 trillion question, a complex one. But if I may take a little bit of time first to synthesize the wisdom which has come from this floor before talking about leadership and my impression. I think I'll start with what came from the right side, from Professor George, on the intelligence of viruses and the way they operate and where they are connected and the symbiotic relationship which they have. They're weak, but they're interdependent, and they know those interdependencies and they exploit it. And to my understanding, their main purpose is not to kill humans. Their purpose is to continue their own generation, right? So this is why this symbiotic relationship exists. And I'll link it back to our governance and leadership question. Humans. And this was the second point which was made, that humans, we are on top of the food chain because we have successfully either conquered or killed, the different forms of life, right? And the way we look at it is that either a relationship, within families, at the government's level, where you have alliances, where you have your own systems of collaboration, whatever you call it, for security, for economics, for social and political coherence. And then you move up from those relational things to transactional things, where it's more of a business which works. You move further up, and then you go to cooperation, and you move further up, then you have competition, and then conflict. So for me, a $1 trillion question related to what we are discussing here is that we have science, we have technology, we have finance, we have systems, we have institutions, and we had information that a pandemic is coming. But still 7 million people died, according to WHO. And if I include all those which are not counted, 21 million people died, right? It all depends. Now I come to the leadership question, how politicians think, my own understanding. I think it all depends upon the choices that we make. If there are billions in global health, there are trillions in conflict management. So if we are choosing to put trillions on that side, on the defense side, on the conflict side, on getting ready to tell the other that I'm better than you, then I think we have to think radically and honestly and ask some hard questions. Otherwise, we'll continue to discuss building trust, building institutions, but they will not work because the umbrella under which everything works is geostrategic, geopolitics, geoeconomics, geotechnologicus. I think we have to be very mindful that another point was made on sovereignty, right? If our existing systems are built in a way that sovereign states decide everything, and you build institutions which are 100% dependent on states in terms of their governance, in terms of their financing, and if all those governors are breathing on the necks of those leaders, be it the UN Secretary General or the WHO Director General or any other institution, then where's the leadership space over there? There's hardly any leadership space. So for a politician, for a prime minister, for any of the ministers, I used to run 10 ministerial meetings every year. For them, their constituencies are more important, which is their primary concern. Their national interests are more important, which is a legitimate concern because they have been elected to do that job. And unfortunately, that precedes everything. So this is why, to my own understanding, we have to have a radical rethinking of the international governance system, the post-World War II system which exists, to see what kind of changes and adjustments are needed to make it more ready for the challenges which we face for an interdependent world.
I hear you're very, very critical, but you're not saying directly what's highly dysfunctional. You don't go there, but I can hear you that you say there's a lot which is not working. That's basically what you're saying. But you're also saying, well, you said we need to ask the tough questions. Is that what you're saying? Yeah. George, if you would ask the tough questions to politicians, what you would like to improve to make the system more functional, what would be such a question?
Yeah, I think, tough, when you are talking about what does that mean, tough? I do agree with Nabel, and he said something about after World War II, we are talking about here, remember, it's a global. When you are talking about a global coordination, especially at this stage, we really need to think about rebuild the world order. And we are now in that position. The whole system after World War II, I do agree with you. It doesn't work at least 100% or 50%. The number, the percentage down to lowest. We need to rethink. I think this is a very tough question. What can we do for the future? And can global health really go global? That's a very tough question. Because think about the pandemic. Different countries, they are doing different things. There's no real coordination, the so-called global health. But we have all the professionals like us, we are sitting here, we are talking. And you practice, we cannot do anything. Because as I said, it's a very complex question, financially. And so in this case, we have so many beautiful words or expression. Public health, that should be public, but eventually it becoming private, a small group. And then global is just, also, a very small circle. Now we are talking planetary health. So what does that mean? Universal health, one health. So many words or expression, but by the end, we have one word, but we cannot have one health. So this is, I think, it's a very tough question. We need not only ask the professionals sitting here, though Shamshad said she is not a politician, but you're a finance minister. It's a typical politician. You're the cabinet member. But even you think, for all this distribution or allocate of the, money, all this, it's very difficult. So I think the real tough question here today, can global coordination really go global?
I agree, that's a really, really tough question. But we have to ask ourselves this question. And Bernhard, you, with your experience in the institutions you work and close to government, and also having seen the problems, like in Germany, you mentioned the beer festival. For your information, the beer festival is a big party, where a tradition in Germany where people come together and drink big amounts of beer, and it was not clear. The government could not decide to say, you can't do this. It happens on another level. So the responsibility was not national, it was regional. And first of all, we had to learn who can take which decision, basically. So that already may take some time. But having said all these different things from the panelists, what do you think do we need to improve in terms of leadership and the institutions we have now in place, the systems have in place, really to achieve something more coherent and appropriate, so that we at least can head towards individual health, so that the doctors can do their job as good as possible?
I would like to start with, I think, Ian, you said something. We are in a cycle of panic and neglect. And we forget very fast. In many ways, it's actually good. I mean, to be able to forget pain is what keeps us alive, right? And I would describe the COVID pandemic was extremely painful for pretty much everybody, and we just want to get over it and forget about it. Now, that is very dangerous, and I come back to that because it's very often difficult to think very rationally in an emergency situation. Because it is difficult, because you have so many pressing needs. You have to keep people alive. And you don't think, how do I change the law that next time I can stop the beer festival, right? I mean, you have different decisions to take as a finance minister. You have to distribute money in that moment to the right clinic and buy an ambulance or whatever. Very concrete things. Now, but what has to happen is that when this thing is over, you really have to sit down and think through, how do I change my law on communicable diseases that I can act better in the future? And I use this example because in Germany, my country, I haven't lived there for many, many, many years, but still is my country, that actually happened. That's a good example. So people then sat down and say, we have to rewrite parts of the law to make sure that in case something like that happened, which really requires a more central coordination, and very quickly, because time is of the essence. So that has happened. But I equally see how quickly in the global debate, and let's take the financing for WHO. I think WHO is in a massive financial crisis a year after the pandemic is over. And the biggest gap is in the emergency work. How can that be? How can that be? I mean, wouldn't that be the time where we say, we talked about the money. You talked about 11 billion for 5 years. That's the 2-year budget of an average hospital in Berlin, in New York. Some big hospitals actually, probably reach that level in a single year. And we can't get globally the resources to build the institutions that protect the world, that protect us in the next epidemic, that protect us from 25 million people, or whatever, 20 million people dying, from trillions of loss in economies that we suffer from in the decades to come. So that's a real issue. And that is where I think the forgetting is really, 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 really bad. Now, the second point I want to make, and it's a personal observation as well, and I think you asked the politician, how can you make decisions more stable? And I think your answer was, I'm not a politician, which was a good answer, and you're right, because you were brought in by politicians to fix when they had failed, and exactly. So, but the one thing I learned, and it was very hard at times, I can tell you, as advisors to the politicians, we have to stick to science. Science is the only thing that survives. Science and honesty is the only thing that sustains in the end. If you deviate from that, you're lost. I've been in situations where ambassadors, ministers, presidents basically came to WHO to offer transactional deals. You know, you say something and then we can do something for you and da-da-da-da. At the end of the day, the only thing that works is that we cannot do that because it's against the science. Now, that may have ended a meeting in a harsh situation, but it was the only thing that sustained in the end because we stuck to the same thing and said, you know, we have to act on science, even though it may not be convenient. But at the end, it came back and sustained. So I think one of the things is that also goes back to my own, I mean, to George and others who are actually advising politicians. And it goes back to what I said earlier, the network that we need to build to connect the scientists, to connect the professionals in the field, because it stabilizes them. It makes them more powerful, being able to talk honestly also to a politician if they come and ask you, can't we say this, can we say the following? The person will feel more empowered if he knows I'm acting on a network. I discussed it with all my colleagues. I mean, this is really the only thing that works. It makes it much more powerful. So I think that's really the critical thing. Go back to science, go back to honesty. And then, there's always a different level of taking decisions, and fine. And a politician may have to defend his or her own decision, but the science needs to be stable, needs to be brought forward.
Yeah, that's thank you so much, Bernhard. A very important point. We didn't discuss this actually at this panel, the role of science, but for me as a doctor it's so obvious, but it's probably not obvious enough for other people. But there is no way around science. That gives us credibility. That's the way we function. The medical world is trained, science-based. But we are sitting down here to think and analyze what needs to be changed to improve. We have had an open discussion here. So the Boao Forum makes an effort actually to have this discussion and also with a broader audience. Part of the event is also to integrate you, the audience, and to ask questions. We are now at 11:15. The idea was that we start taking questions a bit at this point of the event. Are there any questions in the audience you would like to address to some of the panelists?
I'm Goheer Chu from Australia. Thank you for the panel. And I'd like to follow up on the importance of preparedness for the next pandemic and the importance of science. But let me start with the short one thing. We need to be better at science communication so decision makers can understand and then they can help them to make the decision. Now with the preparedness, your report is quite good, but I'd like to remind you that the JEE, the Joint External Assessment, those who rank higher with the higher income country, they do the poorest in terms of, in this COVID, in terms of death and the cases, right? So on top of them, of course, America, UK, and so on, and that you point out the crux of that is that in the next of that, the leadership. But that is not enough. We have leader, Hitler is a good leader in terms of strong leader, but it's not ethical. So it's the ethical leadership that is most important. Now, talking about ethics is infiltrating everything that you talk about in decision making. The science of ethics, the science of moral, is an important gatekeeping for humanity. And yet, we're not doing very well with it. We're not serious with it, except in granting body. Well, do you pass the ethical approval? We need to translational it to policy and practice, infiltrating in all decision-making process, helping the leader to make the ethical leader. And in terms of COVID, ethical decision-making by leadership, one of my PhD students has shown that is the most crucial decision-making. And you talk about nexus to public, don't blame the public. And because science did not communicate very well, but secondly, media have persuaded the public so much. And the media need a really strong dose of ethical training. And then we're not talking about just moral, we're talking about operationalize, make it effective in the decision making. And that's a lot of research gap there we need to really do. In terms of finance, political economy always also affect decision-making about how do you distribute funds. And we have case study in Bangladesh, we can see that as the case. And how do we actually make the science of ethics and integrate it into the decision-making without and counter the political economy decision-making is very important. So in a nutshell, I think JEE report is outdated, I think. We do need to update to prepare the world better, to prepare the future pandemic. And out of which everybody mentioned leadership is important. But don't forget, ethical value is ultimately safeguard to humanity and sustainable development. We need to do better. We make it effective, actually functional. And that's a challenge. And by the way, that's for technology, AI too. If we don't have that built in, the ethical training and into machine learning of this, we are doomed. Thank you.
Abha, you want to just quickly comment what the lady said?
Well, actually, I agree with most of what you've said. And that's part of what, when I was saying that you need, when you develop ethical framework, that ethical framework should be used to make decisions. That's all your policies. If they're not bound by ethics, then your policies will not be acceptable or may not have, they may not be trustworthy because people don't know why you are saying what you're saying. So ethics helps you provide a framework which explains why you're making decisions, and then that makes trust more, makes it more trustworthy to people. And I also agree about, you talked about digital and AI. That's something very important. It's not only the issue of use of technology, which is great. It needs, more and more technology needs to be used. But we need to know whether or not this technology is based on an ethical framework, which means because all this technology uses information and data. Where is the data coming from? Are we getting data from all the sources that we need to get the data from in order to make decisions? So if your data is coming only from one part of the world, and you use that data to make analysis and come to some conclusion, and then you say, the whole world should use it. But the data which did not come from one part of the world, your analysis will not find solutions for those people. So unless you have an ethic, you know that where your data is coming from, how is it being analyzed, how is the algorithm being formed, and if people know all this, then only you will be able to make decisions which are based on a full evidence. You can't have decisions based on half the evidence and then apply it to the whole world. And that's a big problem, because I think one of the biggest problems that we haven't actually had time to talk about is this, the ethics of haves and have-nots. When you talk about sitting around the table and sharing knowledge, is the knowledge diffusion across the table the same? Or are there some people who have more technology, more knowledge, more information, more money, and others who have less? And then we ask them, this is not a level playing field. And then there is this power relationships and brokering of information and brokering of different sorts of things.
Thank you so much for commenting or adding what the lady said. Yeah, you would like to... First, is there anybody else in the audience who has got a question? Yes, the gentleman here on the right.
My name is Andy. I'm from Sinopharm, a subsidiary company of Sinopharm. That I noticed the theme of today's discussion is strengthening global coordination. So I have a concrete case to share, and I wanted to have your comments on this case. During the just past COVID epidemic that we have seen that before the development of the vaccination be used, that the human plasma was the first defense and also the first adopted treatment for treating patients with these symptoms before the vaccines were developed. And afterwards, that the World Health Organization, WHO, have encouraged to enact guidelines to encourage the adoption of this kind of treatments, and to encourage the setting up of regional centers to develop and also produce this human plasma-derived medicinal products for preventing of future pandemics. And as such, that when it comes to the implementation of these guidelines, that we have encountered difficulties, because during the drafting of these guidelines, that it is very clear that there is this centralized organization like WHO that have this authority and also the professionalism that could very effectively coordinating that needed a professional to draft these guidelines. But after the passing of this COVID, similar pandemics, that when it comes to implementation of these guidelines, that we see that there is missing link, that there's no such centralized authority organizations that could effectively coordinate the implementation of this. When we take the initiative to talk with other neighboring countries, saying that you can see that there's already guidelines that we should follow. However, that there's always conflict, like who is going to do what, and what is the benefit sharing mechanisms. So my question or my doubts here is that is it possible that countries, leading countries spearheading this effort, that could identify or even establish new global organizations similar to World Health Organization that could effectively coordinating the implementation of these guidelines after the drafting of it, instead of leaving it on the shelf and actually no forcible implementation of that, which is a waste of resources, I believe. Thank you very much.
So much. We're almost at the end. We have 3 minutes left. Many of what you said, a lot of what you said ties into what has been discussed.
Yes.
Ian, would you like to respond to what the gentleman said?
I can't respond to the specific example that you've given. I don't have the background on that, but I can respond more generally in terms of how we take a normative guideline, which WHO is responsible for, and then translate that into national practice. And of course, the primary responsibility for the implementation of any guideline at the national level remains with the government of that country. Now, of course, that requires often some support and some encouragement to do so, and WHO does get involved in that. But very often also, there are groups of countries which together, and particularly when it comes to the regulatory aspects of new products or the use of products, work together in order to ensure that there is a shared standard, that standards are shared, that they are working together to ensure that those products therefore can be marketed or transmitted between countries, or traded between countries, so that they are not an obstacle to the use of that particular product. And there's some very good example, particularly I think now in Africa, of groups of countries together developing common shared regulatory approaches to these key products to ensure that when something comes out that is going to need to be adopted very rapidly, for example, in a pandemic, it can be done so with a shared regulatory mechanism that will ensure it can be used very, very quickly in those countries.
We are almost at the end of the panel. I would like to thank all the panelists. Yes, please.
Okay, so a short one. I think in all these debates that we have talked about, we really need to recall that the primary responsibility for the final negotiations on this whole matter of financing rest with the Security Council at the end of the day. So it's important that we think of greater empowerment of the Secretary General himself to be the final decisive person who is actually focused on getting a final resolution on that front. And it's important because it's really the Security Council that can take an independent position, as you were also trying to figure out who takes that final. So I wanted to emphasize that that's one area. And the second one, as I had pointed out earlier, was a coalition of countries and also a coalition of the World Bank coordinated bodies that can play a very instrumental role in pushing for reaching the numbers that we eventually want.
Thank you so much. I hope that this session was a learning session for everybody, because I think it's first of all about learning together, and we learn through dialogue to build the future, and to build a future that protects humanity and allows to develop human potential the best way. So thank you so much for attending the session. Thank you so much, the panelists, and I wish you a good rest of the day.
Lastly, I would say thanks for raising the issue about AI. I think the global coordination will be done by AI. Thank you. Not the human being. We can't handle this.
尊敬的各位来宾，本场会议已经结束，请您将同传设备留在座位上或归还给工作人员，有序离场，携带好随身物品。感谢您的参加。Dear guests, the opening ceremony and the plenary has concluded. Please leave the simultaneous translation equipment on your seat or return it to the staff. Leave the venue in an orderly manner and take your belongings with you. Thank you for your participation. 尊敬的各位来宾，本场会议已经结束，请您将同传设备留在座位上或归还给工作人员，有序离场，携带好随身物品。感谢您的参加。Dear guests, the opening ceremony and the plenary